Hello and welcome. You're watching Coronavirus Facts versus Myths. India has crossed the grim milestone of over 3 lakh coronavirus cases. India reported 3.14 lakh new cases, the world's biggest ever daily surge. In another grim record, 2,104 COVID deaths were recorded since yesterday. India is facing one of the biggest healthcare challenges in recent years. There's a shortage of medical oxygen, hospital beds and drugs. This is resonating in the Supreme Court now. Today on the show, we'll look to understand the magnitude of this catastrophe. We'll also bring you the good news that vaccines work, and even against the deadly mutations they work. The Bharat Biotech Covaxin has shown a 78% efficacy, this according to Bharat Biotech. The ICMR has also come out and said that Covaxin can effectively neutralize a double mutant strain. More good news, if you are above the age of 18 years, within 48 hours, you can now register for the COVID-19 vaccination. This is scheduled to begin from the 1st of May. So effectively on Saturday, you can register to get the COVID jab. But before we get you more information, I want to play out for you a clip which you've probably seen. This is a plea by a doctor.
Sorry. We have to literally manage patients at home with oxygen, and this is not something we are enjoying. हम young लोगों को देख रहे हैं. I mean, we have a 35-year-old who's on the ventilator, and we are not able to help people now. I think ये जो emotional breakdown है, हम doctors में अब सबको कोई ना कोई समय हो रहा है, because we've not been so helpless. Okay.
Dr. Tripti Gilada Baheti is the doctor on your screens. She's joining us on the broadcast. She's an infectious disease specialist. She works at a hospital in Mumbai. Dr. Tripti, thanks for speaking with NDTV. You've made a very emotional appeal in that video. I want to first thank you for your selfless service at a time like this. Just how bad is it?
Right now, I think there are no words that can describe the magnitude of the problem that we are seeing, because, at least in 2020, what we saw was shortage of beds. But never had we imagined that we would even have shortage of oxygen. And things that happened yesterday, like not just in Bombay, now we are seeing it all over in Delhi, in tier 2, tier 3 cities across India, that it's shortage of ICU beds, it's shortage of oxygens, and it is shortage of medications. So with 3 most important things that we require to help a patient, and when we are not, and we don't have enough of that, it just goes to show how big this problem is in the country. And even as the numbers keep rising, we still continue seeing people unmasked, not really following all the COVID appropriate behavior. Still so much vaccine hesitancy, despite the fact, like you just said, vaccines do work. And this data has been available to us for months together now that vaccines do work. I think we have the precautionary measures available to us. We just need to put them to the right use now, because it's already late and it'll get even worse now.
Dr. Tripti, I want to also ask you, because, you said in that viral video of yours that, every doctor who's been fighting this pandemic in the front lines is having these breakdowns. Just how difficult has the last 1 year been for health caregivers like yourself?
So honestly speaking, care in the hospital is not difficult. What is really getting difficult to us is frantic calls from relatives, friends, who we should have been so easily be able to help, But it's people who are calling us for hospital beds, for ICU beds, for oxygen. And it just goes to show that a doctor or, people who are connected with the healthcare facilities cannot help themselves sometimes. It's sometimes difficult even to find a bed for a hospital, for a doctor. If a doctor cannot find a bed for himself or herself or the relatives and the friends, just imagine the plight of a common man who has no connections whatsoever.
I want to also ask you, as a doctor on the front lines, how is the second wave different from the first, and how much more difficult has it been for doctors like yourself?
There are some differences for sure. And, initially we thought that the new mutant strain is more infectious, but will not probably be that lethal. we think it's probably equally lethal to patients, but what's really changing now is the sheer numbers. So even if it is smaller percentages of people who require the ICU, or even if it is smaller percentage of people who actually succumb to the disease, the magnitude is so much that smaller percentages are really translating into numbers big enough for the healthcare system in the country to be overburdened. And I think this fact is probably the major difference in what we saw in 2020. I mean, we did see a period of 4 weeks even in 2020 where the ICU beds were overfull. But the shortage of drugs and the shortage of oxygen is something that's really adding to the stress of the healthcare givers and the patients alike.
All right. So it is an extremely difficult time. And like I said, on behalf of everybody, it's thank you to people like yourselves who are holding fort. I want to shift our focus though, and do stay on with us, Doctor, to the good news that we are tracking as well, which is that Bharat Biotech yesterday said that Covaxin has 78% efficacy. This is phase 3 results at the moment. This is a claim that's being made by Bharat Biotech. They are saying 100% protection against severe COVID disease, 25,800 participants in phase 3 trials. This is analysis of over 14 days post the second dose of the vaccine. The ICMR has also said that Covaxin neutralizes the multiple COVID variants and effectively neutralizes the double mutant strain. This is important information that's coming in. The government of India has also issued statistics now on adverse reaction after vaccination and protection, and what they've essentially said, make sense of all of that data, is that vaccines work. Dr. Singh, Dr. Sarman Singh, Director of the All India Institute of Medical Sciences from Bhopal, as well as a senior virologist, joins us on the broadcast. Thanks so much, Doctor, for being with us. We also have Professor Girdhar Babu, Professor and epidemiologist from the Public Health Foundation of India in Bengaluru. I want to ask you first, Dr. Singh, as a virologist, how are you looking at this data that's been presented by Bharat Biotech, and the fact that the ICMR claims that the Covaxin works against a double mutation? How important is that information?
Before I come to the main question, I first of all, my sincere, solidarity with Trapti, and I share my sentiments, what she is saying. And most of the doctors on the floor, or those who are administrators, they are feeling the same thing. And 100% I agree with her. And definitely the situation is becoming very, very alarming, as the Honorable Supreme Court also said that this is a national calamity. And I think the government of India and all governments, they should focus all efforts and on this epidemic. Now, coming to your question, definitely this is something which was expected, because this is a whole virus inactivated by a chemical known as BPL. So similar vaccine is available, Sinovac in China. So that also gave the similar results, and because it is a whole virus, and so all proteins, particularly the spike protein, that is intact, and therefore it is expected that it will work. The antibodies against the spike protein, they will work on all the mutants as of now. But the new mutants, say for example, which makes changes in the spike protein, then it may be a problem. So it is not that as of now it is working. So therefore it is very, very important, as Trapti also said, and we have been saying that multi-pronged approach has to be there. We need to continue with the vaccine. We need to continue with the appropriate behavior. We need to continue our efforts on the remdesivir, other antivirals, and the oxygen. So all multi-pronged approach is required to bring this wave down.
Right. Dr. Babu, Professor Babu, how important is this piece of information? And put it in context for our viewers, the data that's been released by the government, which talks about the fact that vaccines work. They will give you the protection that you need from at least severe COVID infection.
Yeah, Rishik, I think this is a very promising result from Covaxin, where they have produced both the results for the overall infection, which includes mild, moderate, and severe, which is at 78%, with the range of the interval from somewhere between 61 to 88, which means even the lower limit of the confidence limit, say that this is above the WHO standards for acceptance of a vaccine, which is good news. So whether it is mild, moderate, or severe, this vaccine is going to be effective in preventing it. And another piece of information which is more important is, yesterday, the government of India announced that what are the chances of breakthrough infection after somebody has vaccine? What are the chances of people getting the infection? It is to the extent of 0.04% for Covaxin and 0.02% for Covishield, which means that vaccines are going to be the mainstays of the strategy as we move ahead in fighting against COVID-19 response. To the extent that third wave definitely will be there sometime later in this year, but almost it can reduce all the mortalities, all the severe infections, if the vaccination could complete before, maybe Diwali time. So this is good news in terms of vaccine.
Well, and I wanted to focus on that good news because it's very important while we continue to highlight the plight of what is happening on the ground across hospitals, across different states. It's also important to highlight the fact that we do have a vaccine. 2021 is different from 2020 because we do have a vaccine. If you're eligible, you must absolutely get the vaccine. But I want to shift our focus back to the India numbers. Dr. Tripti, you yourself have been saying that there are patients you're trying to manage at home because you just don't have the infrastructure. India just we just don't have the number of beds or the oxygen to look at the sheer numbers. At over 3 lakh cases on a daily basis, India is currently seeing the worst ever spike that any country in the world has seen. What is the ground reality? Are patients being turned away? Are people being denied healthcare? How are you managing patients at home? What's happening?
So, yeah, I mean, that's happening, I think, all over the country, where people who really need to be in the hospital are not able to find hospitals. And it's not just health, it's not just being in the hospital. For example, even the RT-PCR reports are taking 3 or 4 days now. So, there's a wait list for tests, there's a wait list for admissions. And obviously, once they get to the hospital, there is a shortage of oxygen and the medicines. So I think we will have to make a strategy right from the country down to every state, every district, and to every hospital to maximize whatever resources we already have. I mean, it will mean triaging patients. It will mean not taking in milder cases into the hospital and leaving the beds for moderate to severe illnesses, because once you keep a patient with pneumonia waiting at home for 2 or 3 days, by the time we take them into the hospital, we've lost some very precious time that we could have offered good health. So I think it will need a lot of understanding, both on parts of the government and the public, to understand the enormity of the situation, and everyone will have to play their role very, very responsibly.
Dr. Singh, on oxygen shortage, we are seeing a dire situation play out in Delhi. Courts have been petitioned. These are now issues resonating in the Supreme Court of India that's calling this a national emergency. What is the situation prevailing in Tier 2, Tier 3 cities? How bad is it? What's your assessment?
Yeah, it is really a concern, but government is trying its best. But definitely the situation is all over country, similar as in Delhi. And many people, they are holding the cylinders and they are looting the cylinders and trucks. So it is really a grave situation, and therefore, after the government of India has now directed that all the industrial oxygen should be diverted and to the as a LMO. So this is probably going to help in maybe coming few days, but definitely as of now, this is really alarming situation. But definitely everybody knows that
it's an alarming situation. The numbers, of course, speak for themselves. There is, of course, a human tragedy which is playing out. We're trying to highlight as many of those stories. But we'll continue to answer your questions on COVID-19. We'll continue to highlight those voices. We're going to slip into a very short break. Our phone lines are open. Our panel of expert doctors is going to continue to be live with us on the other side. Call us, ask your question, and we'll have the expert doctors answer it. Welcome back. Our panel of expert doctors continues to be live with us. Our first caller, Ruchi, dialing in from Mumbai. Ruchi, go ahead.
Yeah. Hi, good afternoon. Just need to check that if after the first dose, like my father had a first dose of vaccination, he detected with coronavirus, and it's now been 15 days. After the 15, his second vaccination is due. So can he take his second vaccination?
Right. Dr. Singh, would you like to answer that? If after your first jab you get COVID, how long should you wait before you get the second jab?
Yeah, because after 15 days of the first vaccination, he got the infection. So definitely after 1 month, that is 4 weeks after the infection, he can take vaccine without any problem.
All right. Next caller, Madhav, dialing in from Chandigarh.
Good afternoon, ma'am. I wanted to ask if we have patients with comorbidities and who are isolating at home, how should we assess them for a cytokine storm and what are the signs that we should look for?
Right. Dr. Tripti, would you like to take that on?
So the most important clinical sign that can be easily picked up is continuously monitoring oxygen saturation every 4 to 6 hours and monitoring that at rest and after a 6-minute walk. A drop in oxygen saturation below 94 or below that after a 6-minute walk is one of the earliest signs of an impending hypoxia. And I think that's the time when you should get in touch with your doctor, and then they will evaluate you on whether a hospitalization is needed or not.
Right. Can you also just explain, Dr. Tripti, for the viewers who don't understand, what is a cytokine storm?
So a cytokine storm is usually seen in the second week or after that of the COVID illness, where there is just so much immune reaction to the virus, which starts affecting several organs, and one of the most organs that gets affected is the lung and the entire circulatory system. So, but one thing that we still want to tell our viewers is that cytokine storm is being used very loosely. There is a very tiny percentage of people who actually experiences cytokine storm. So just by doing blood tests and seeing raised levels of certain markers does not mean that a person is in cytokine storm. There are very strict criteria for what a cytokine storm is, and your doctor will be the best judge to tell you whether it is a cytokine storm or not.
All right. Our next caller, Anoop, is dialing in from Dwarka in New Delhi. Go ahead.
Yeah, ma'am. Ma'am, if you can see, there's so much fear about this coronavirus that people are not allowed to go near the dead body. Even, people are not allowed to perform their rituals also, last rites also properly. The fear that they will catch the coronavirus. So see, even a dead person also, deserves some dignity of the death. Now, what we understand is coronavirus is spread through aerosol, through nose and mouth. Now, when a dead person do not talk, a dead person do not breathe, then how aerosol can be expelled from his body? How the person near the dead body can, get the coronavirus?
All right.
Well, the only way transmission is through aerosol.
Okay.
Now, when dead man does not expel an aerosol from his nose or
let me
mouth,
get.
I think we understood this fear.
Right. We appreciate your question. Let me get Professor Babu to answer that. Professor Babu, I'm sure this is, it's a difficult question and a difficult time for several people. What should be the protocol?
Yeah, I think we need to understand virus needs living tissue to replicate. Once the tissues are no more living, the virus also dies with the death of the person, one. Therefore, it can't also transmit. So we need to be getting away from this stigma and make sure that we treat dead bodies with definitely dignity, and with the minimum precautions we should be able to allow the family members. So from what we started in types of dead body management to what is now, there is a lot of improvements. I think now we need to be more human in treating the dead bodies with respect. Arishika.
All right. Well, I hope, Mr. Anoop, that answers your question. I'm afraid that's all we have time for on the show today. Thank you so much, doctors, for sparing your valuable time and being with us on the broadcast. We will continue to track India's COVID story very closely. We'll continue to highlight your stories and your concerns on the show. Till we come back to you tomorrow, wear a double mask and stay safe. Thanks for watching.